Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. What is a holistic health approach and how can it benefit you? Learn about potential benefits from an expert in this area. Helping Seniors TV host Kerry Fink talks with Dr. Kevin Kilday, PhD, of Holistic Health Centers on this edition of Helping Seniors TV. I'm Kerry Fink with Helping Seniors TV, and what a pleasure it is to have you joining us today for Helping Seniors Television. I have the privilege of sitting in for Joe Steckler, who is our president and founder today, and my name is Kerry Fink, and we have a great show prepared for you today. It's all about holistic health centers, and you're going to really get a lot out of today's episode. And I want to welcome our guest, who is Dr. Kevin Kilday. Welcome to the show.
Thank you. I'm glad to be here.
It's going to be really fun to unpack all that you need to know, because as we get older, we have different things that we run into, and sometimes the prescription is not necessarily always the right answer. There could be another way to look at things. So one of the things that I wanted to do as we get into this is if it's all right with you, I'd actually like to jump a question first to say, if somebody has heard this term, holistic health, we sometimes don't know exactly what that means. Could you give a person that doesn't really, or they may have heard the term bandied about, but they don't really understand what holistic health approach is, just a quick overview of that?
Sure. Well, holistic is taken from the word whole, and it stands for, like, the whole person. And what we do in the holistic field or alternative medicine is we help the whole person, including the mind, the body, and the spirit, because they're all connected. If the mind is out of balance, it's going to affect the body. If the body is out of balance, it might affect the mind, or it might affect your spirituality. Spirituality is a very important part of healing and having a relationship with your God, because you really need all three to thoroughly heal from any type of disease.
And I think there's, correct me if I'm wrong, but I think there's even another aspect that, as you were saying, that made me think of. There's a very well-known periodontist, Dr. Lee Sheldon, who does a lot of, he's a big part of the Helping Seniors Network, and he and Joe have done a number of shows over the years, and they'll talk, obviously, some programs on making sure your mouth is healthy and things that you can do to have a healthy mouth. But he's also a medical professional who believes very much that your mouth is connected to the rest of your body, meaning that what's happening in other places of your body is impacted by your mouth and vice versa. Is that part of holistic when you're thinking about everything working together as a system?
Well, yes. I mean, what you put in your mouth, and what you eat, we have a lot of choices today, with processed foods and fast foods, that, as far as, as I am concerned, helping somebody with a disease, those type of foods are not good. It's best to go with natural foods. Again, it's the holistic approach, the physical part of it, to help the body heal itself. And you do that with good, nutritious, fresh food, the freshest you can get, fruits and vegetables. If you're a meat eater, you're best to go with grass-fed beef or cage-free chicken, and of course, a mercury-free fish.
Right. So there's a lot of nuances I'm sure we're going to get into as we go along. I just wanted to set the stage to just kind of have everybody get on the page that with holistic health, we're talking about the person overall looking at all aspects of their health. Is that a fair way to?
Yes. Okay. Yes. Yeah. So, the mind, body, and the spirit. It's they all work together. to keep the body in balance and just keeping in the healing process.
So you have an incredible background. We were talking before the show. I keep learning new things about all the different things that you've done. You've been a pastor, a praise musician, Christian counselor. But let's talk about your education and background and how it came to be that you saw a place to help people through holistic health.
Yes. Well, in 1998, I seen. Firsthand, a lot of people addicted to, to alcohol and drugs, and I already had I was already working on a bachelor's at that time, and I achieved that, and then went to a master's in pastoral counseling, and then in 2007, I achieved a PhD in pastoral counseling, and but I was involved, from 1998 to 2005. I was involved in the addictions field, and I had become an ordained pastor, and I was an associate pastor of a church called Agape Community Church that was in Palm Bay, and their main ministry was alcohol and drug rehab. They started out in Melbourne on Babcock, north of the railroad tracks. Stayed there for a couple of years, and then the senior pastor purchased a church in Palm Bay, right on the borderline of Palm Bay and Melbourne. In 1990, well, actually in 2000, he bought that. And it was not a very good neighborhood, not safe to walk the streets at night, a lot of drug dealing going on. And there was 10 apartment houses across the street from the church. And he said the very first week, we're going to take over those apartment buildings. There was like 3 apartments in each building, and there was 10 buildings. So to make a long story short, within 3 years, we occupied 8 out of the 10 buildings with people in recovery, and we actually made it a residential addictions program using those buildings, and it was safe to walk the streets at night. No more drugs. There was no more prostitution. Even the police praised us. It says since your church has come down here, we've had very, very few calls in this neighborhood. So it was a great an honor to be part of that church. And then in 2005, some things happened. The senior pastor got called away because his both of his parents were ill, and he had to go take care of them and turn the ministry over to somebody else. And the other gentleman tried hard, but then so unfortunately the church had folded in 2005.
But with that experience that you got there working on that level, is that part of what gave you the interest in moving forward with holistic health?
Yes, because I was already doing it to a degree. I mean, I was helping. Unfortunately, when addicted clients come out of detox, sometimes due to the doctor's discretion, they come out with some more pills, to make them a little bit more comfortable. So as a addictions ministry, we had to keep a watchful eye on that and gradually get them off of them. And then I was in charge of of course some counseling, running, chairing group therapy meetings, also and helping them with because we had a full kitchen in the fellowship hall, and I was in charge of supplements and making sure everybody was eating good,
right?
And it's all important in in addictions recovery. So really, I started my holistic career really, between 1998 and 2005.
So when you think about how your education and background in holistic health kind of brought you to this stage, now as you talk about Holistic Health Center today, what kind of products and services does that mean for a consumer?
Well, a little bit more of a background, in 2005, after the church
Hmm.
gone under, I just started a nonprofit ministry called
Hmm.
Life Recovery Center, and I
Okay.
was just focusing on outpatient
Mhm.
Christian counseling, and I did that until 2013,
Hmm.
and then I put together the foundation for holistic health,
Right.
and then started that officially in 2013, and
Okay.
merged Life Recovery Center with holistic health.
Okay.
So, but and I made holistic health specialty, alternative cancer therapies, because I received well, around 2011, 2012, I lost two family members back to back
Hmm.
from cancer. And one unfortunately was only 49 years
Oh
old,
my
and
goodness.
it actually came back because he fought it and beat it in his late 30s.
Hmm.
So it actually came back, and unfortunately he passed from it. But I seen up front and close the traditional uh, treatment of cancer was, and I just said to myself, I'm into nutrition, and there's got to be a better way. And I just started reading and researching, and then another one. It's the same thing. It was actually my father-in-law had passed on. I mean, he was 72, which is kind of
Hmm.
young in these days. But
Hmm.
again, he had a cancer that came back a second
Hmm.
time, and he passed from it. So. Um, so I ended up pursuing another doctorate uh, in natural health.
Aha.
So because of that, and in 2012, and then in 2013, during that time, I wrote a protocol called "Winning Against Cancer," which is a whole natural approach
I was going to
to.
ask you about that because I've heard, I don't know, I've heard a lot of times people suffer so many effects of just the treatments for cancer that it itself can be a problem. So when you say winning against cancer program, what is that?
Well, it's a protocol that I wrote. It's on my website, holistichealthcenter.us.
Uh-huh.
And it consists of numerous things. It starts out with detoxing the
Hmm.
body first. First we start out with detoxing the intestines to get rid of uh, just bad things in your intestines, including parasites.
Mm.
You know, like 85% of the population has parasites and don't even know it. It's a
Wow.
common thing,
Wow.
and they can weaken the immune system. So we do an intestinal cleanse first, and then we do a colon detox. I'm going to stick with the word detox, and
Okay.
and then we use a body detox, which consists of the detox in the liver, the kidneys, and the blood.
Hmm.
So, and then we move on to the nutrition uh, part of things, and I have. I use a low acid, high alkaline type of diet
Hmm.
because the body needs to maintain a certain alkalinity um, to produce good health. All
Hmm.
right, because there's three areas that I approach uh, in helping people with cancer. Is number one, we have to take away the sugar,
Hmm.
okay? Because the sugar is cancer's biggest food. So
Hmm.
we have to eliminate all the white sugar and all the sugars that sound uh, light sugar. I mean, the food industry has actually a couple hundred names for actually sugar.
Wow.
You know, the easiest thing to do is anything that ends with OSE is
Mhm.
probably a sugar.
Okay.
All right. Um, so you eliminate that. Take away the cancer's food, and so the cancer will starve itself. Also, a cancer can't live in an alkaline environment. So that's why we use what we call a pH type diet, where it's a
Mhm.
low acid, high alkaline type of diet. because we're trying to make the body hostile towards cancer cells, and we do that eliminating the sugar, and keeping the alkalinity at 7 to 7.5, which is really normal. And you don't really need to go much higher than that, because still the cancer cells cannot live in between 7 and 7.5 pH. And then the third thing, we have to increase the oxygen. And we do that by, we ask the client if they're well enough just to start out with some simple, mild exercise of walking. Just getting out in the sun, getting that natural vitamin D, and just, walking, if they're real ill, I just tell them, listen, just start out with 5 minutes, one in the morning, one in the afternoon, but you kind of like need to work yourself up to like at least 20 minutes, 4 times a week. Just getting out and walking. It gets the heart pumping, it helps the lymph system, it gets the oxygen in the system. If they're unable to do that, there's other things that we use. We use what they call a pulse electromagnetic field therapy, and it's really just like it's put out by a company called Beamer, and it is actually FDA approved, and it's also been approved by NASA. NASA plans on making improvements to it.
Oh, wow.
And using it for astronauts coming back from space, because apparently they have maybe some issues with circulation. But that's what the Beamer is good for, is increasing oxygen and increasing circulation and getting nutrients to the cells. So we recommend that. And there's also a couple of supplements too that we might use also to actually increase his oxygen in the system. So that's the physical part of it. We always ask them, once they're diagnosed, how are you doing with this? How do you feel about this cancer, which is very important. Of course, getting those 3 words, "you have cancer," is devastating to a lot of people, to most people. And so are you going to say, well, it's stage 4, my life is over, I'm a goner? No, you can't say that. Regardless if it's stage 1 or stage 4, there's always hope, and there's always ways to treat it, other than traditional.
So one of the things that I wanted to ask you about actually is the very fact we just saw a lecture that came to the Brevard Commission on Aging, where a medical doctor was talking about opioid epidemic. And traditionally, for example, we think about that as it pertains to younger people, but this doctor was explaining that there's actually a growing crisis because of the dependency factor that happens among seniors. And so I know that one of the whole things that you're really strong on and presenting a new holistic addictions therapy program. So I thought that would be a good topic for us to use to kind of address what happens holistically when we start talking about pain addiction and treating pain.
Okay. Well, yes, I have a new protocol coming out that's not on my website yet, but soon, and it's going to be called Holistic Addictions Therapy Protocol or Program, and just like with well, not just like, but with addictions, you really have to address again, like we talked about in the beginning, the whole person. The medical industry considers it a disease. There's a lot of controversy about that, and some feel it's a spiritual problem, and some feel it's a mental problem. Actually, the medical industry actually considers addiction is defined as a chronic brain disorder.
Oh.
It causes social isolation and depression and anxiety and things like that. So that's what their I guess clinical definition of it.
So they're coming at it from a whole different way. So a senior who might say, I'm having really bad back pain, who then takes an opioid, who then becomes addicted to the opioid.
Right. I feel, my personal opinion, and it's out there, confirmed also that, you know, when you're dealing holistically with really anything, you got to come down to the root cause. Okay.
Mhm.
And with the opioid addiction, I believe the root cause is actually pain, is pain treatment. Okay. And that's where the opioids are started from. They were given, oxycodone or Demerol or, all the other, standard ER or doctor, prescriptions for, for pain, and, maybe the pharmaceutical industry knew it, maybe they didn't, but after a short amount of time, people started needing more and more and more to get the desired effect.
Right.
So therefore, then you have an addiction problem. I mean,
So when you
some just try to follow, they're just taking the pain pills and are very disciplined about it. So they may not be an addict, all right, but we have an epidemic in this country, right now, declared by the government. I mean, the opioid epidemic, overall drug abuse, killed 72,000 people in 2018.
It's amazing numbers when you think about it. Well, let me ask this because so far in the program we've talked a little bit about how holistic health therapy can be useful in the example you gave of the Winning Against Cancer program that you've put together.
Mhm.
We've talked a little bit about how some of the approaches that you take can be helpful in terms of things like you described, like with heavy metals, checking for things like that, or looking at things that improve circulation, like all these different things that things that naturally will lower your blood pressure, or different things that we've talked about along the way. But now let's talk a little bit about pain and pain management. If somebody comes to you and says, "Listen, maybe they're addicted, maybe they're not addicted, but they're just coming to you in a case of saying I have chronic pain," are there things that somebody might call you for that you have some solutions?
Well, yes, there are some herbs out there, again, that have been thoroughly clinically studied, that help, with pain, and in a lot of cases, these have been studied, side by side, against ibuprofen or the NSAIDs, as they call them in the medical industry. It's just anti-inflammatories that you buy over the counter. All right, these work as good, and if not outperform, the NSAIDs. The number one that comes to mind is an herb called Boswellia. All right, now Boswellia is a compound from frankincense,
Okay.
which was used during the birth of, as a
Yeah.
gift for the birth of Christ.
Mhm.
And again, it's been around for a few thousand years. It's been well studied. They use it in a lot in the Asian countries and in India, and it does reduce inflammation, which is a key part of pain. When you're inflamed, you're in pain.
Sure.
You know, uh, Another one that comes to mind is another one called tart cherry,
Hmm.
which is an herb. And it's very good for a painful condition called gout. If anybody ever had gout, you're, it's usually in your toes, and it's always in your toes, and you can't walk because you're in so much pain and stuff. This has been clinically studied, and it showed to, reduce the pain uh, uh, quite a bit, almost to zero, where it's comfortable to walk, and it reduces the inflammation, and eventually and like anything else, you got to change the diet with gout and things like that, and eventually you'll cure yourself from it.
So one of the things that's probably a takeaway as we're talking about, because we've covered so many different areas in all the things that the holistic approach could probably be beneficial for folk. It comes back to really somebody needs to avail themselves of the opportunity of sitting down with somebody like yourself or your new ministry and business partner, where you're having this new facility in Palm Bay, Florida, where you're committed to providing these kind of answers or solutions for situations that people are concerned with. It seems like because there are so many areas, they really need to get in touch with you. Set up a consultation, kind of
Right.
go through where they are, where they're beginning from, and then
Right.
you can lead them a bit farther from there.
Yes, I do one-to-one consultations, with the client, and the first one is always lengthy. It's a get to know you type of thing. They have to sign some documents, just like you do in a for a new patient at a doctor's office, and and I just go over what diagnosed health conditions that they want to look into alternative methods for.
That's good. So if somebody's going to get in touch with you, let's go through the phone number. How do they get in touch with you?
You can call me at 321-549-0711. And
say that one more time.
Yeah, 321-549-0711. And the majority of the time, if you don't get the voicemail, then you get me on the phone.
So it's pretty much a straight shot through. And the nice thing is, it's almost regardless of where you live in Brevard County, you're going to be able to access, because you have the new facility in Palm Bay, but you're also in Melbourne, Merritt Island, and so really throughout the county, people can access you.
But the one good thing about the one in Palm Bay is we're introducing the holistic addictions therapy in the Palm Bay office, because we have the room there. We're going to have other modalities available, such as massage therapy. I got a registered nurse on staff to just to take vitals and just to watch for any problems with medications or whatever the health problem might be. And she's very knowledgeable, and she's also a pastor, and has a big background in spiritual counseling, and she's also a hospice nurse also. So she's very well experienced.
Oh, good to know that we have some good alternatives in healthcare medicine as we talk about the holistic approach to it. Well, thanks, Dr. Kevin Kilday, for joining us on Helping Seniors Television today. And I appreciate you being here. And thank you, viewer, for tuning the show. I'm Kerry Fink, sitting in for Joe Steckler, and hope you have a wonderful day.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.